It's usual to run out of breath while pushing your limits while working out. But there's a fine line when ignoring breathlessness as a warning sign can be the difference between life and death. That is exactly what happened in the case of Bobby Jo Green. An enthusiastic runner, a mother of 2 children, and a teacher found herself struggling to breathe. She instantly realized it was more than a minor health issue, but she was startled when her doctor gave her a clean note of health, only to discover a terrible heart condition diagnosed 10 years later. Her mind raced with questions after this shocking revelation. Did her body attempt to warn her of heart illness? Could her condition have been detected earlier? Is her life at stake? Today's video will explore how cardiovascular diseases affect women and exactly what happened with Bobby Jo Green. It was 2014, and Bobby was enjoying a vacation in Cape Town when she felt a sudden collapse. She felt every symptom of a heart attack that women her age usually experience. Her mother rushed her to a nearby hospital, where doctors ran a quick electrocardiogram showing her weak heart caused by a lack of oxygen. Bobby Jo Green was just 31. She recently had a complicated pregnancy and was undergoing a lot of stress. But to stay healthy, she continued her physical fitness routine. She had an athletic personality. Doctors followed up on her case, running several tests, only for the results to come back regular, leading doctors to believe that the first test must have been done in error. Doctors reassured her that she was young, fit and healthy, and had nothing to worry about. They concluded her symptoms to be the after effects of a stressful pregnancy. But her case was not one of a kind. It is what the medical community calls an intersectional stereotype. Heart disease has killed roughly 31,000 women in the US in 2020 alone. And these are not just older and ill women. You see, heart disease works entirely differently for women than men. Comparing the symptoms might not always be helpful. A woman could easily suffer from a heart attack, but it might not be as visibly terrifying to the public eye. Bobby felt that the medical community tends to be gender biased regarding heart conditions, as it shows itself differently in women. Not like in the movies where men will clutch their chests and fall to the floor. Also, 2/3 of research on heart diseases and strokes has been based on analysis of men. People don't always have a heart attack with chest pain, even though both men and women can feel like an elephant is sitting over their chest. Lower chest pain and upper back pain radiating to the jaws and the neck may or may not be accompanied by extreme fatigue, indigestion, shortness of breath, and nausea. But when women aged 30 to 55 years complain about these symptoms, the diagnosis usually is linked to pregnancy, perimenopause, or menopause. From 2010 to 2020, doctors discharged almost 300 women in Alberta from the hospital with such diagnoses. Doctors reassuring them that there was nothing serious going on, but these women returned in just 30 days with full-blown heart attacks. Bobby knew what she was experiencing was not just in her head. She had physical discomfort that the doctors could not put their fingers on. Nothing happened for 10 years. Bobby would repeatedly return to the hospital for regular heart checkups, meeting different doctors and specialists, and keeping notes of her symptoms. Then, a decade later, doctors diagnosed her with coronary artery spasms, a myocardial bridge, and endothelial dysfunction thanks to a novel angiogram. Blocked arteries cause the heart attacks that we typically hear about. When heart muscles contract due to spasms, it can compress the occasional coronary artery segments trying to pass through, called myocardial bridging. The narrowing of a coronary artery when the heart muscle contracts are usually normalized when the heart muscle relaxes. Bobby's condition had nothing to do with her physical fitness. She is now on medication, but might need other forms of treatment if her body doesn't respond. Today, Bobby Jo Green is co-chair for Wear Red Canada Day. She's taking her message to women, encouraging them to raise awareness of heart diseases. If you are unsure of your condition, keep visiting the hospital and asking questions. Misdiagnosis of women's heart health can cost a life, but getting a second opinion can give you a second chance. As medical science advances, intuitive diagnostic tests are coming up to nip heart problems in the bud. There are multiple reasons for deaths due to heart diseases, yet most are preventable. Making advancements in medical public policy and investing in heart health education can help women at risk of heart disease worldwide. Giving up smoking can reduce your chances of developing coronary heart disease by 50% a year after quitting. Even beginning an exercise regimen like walking for 30 minutes daily and changing your diet can lower the risk of a heart attack or stroke. Even though heart disease is the primary cause of death in women in the US, many dismiss these symptoms as a less severe illness, even though the warning symptoms are as clear as day. Do you get regular heart checkups? Let us know in the comments below.
Enjoyed this video? Hit like, share, and subscribe to Curiosity. Wait! Why not fulfill your curiosity by watching these other awesome videos? Go ahead, choose the left or the right video and enjoy.